My breasts are two different sizes. Is this normal? It's common for two breasts to be different sizes, but they're usually similar in density and structure. Doctors use mammograms, a type of breast exam, to evaluate the internal structure of the breast. If your mammogram shows you have asymmetrically dense breasts, the difference in density could be classified into one of four categories if a mass is found: asymmetry. Your breasts are only evaluated using one projection. These images aren't reliable because they are one-dimensional. Overlapping dense structures in the breast could be difficult to see. If your doctor finds a lesion or abnormality, they'll call for another three-dimensional imaging test. Global asymmetry. This finding shows there's more volume or density in one breast than the other. Global asymmetry findings are normally the result of hormonal changes and normal variation. If a mass is found, your doctor will request additional imaging. Focal asymmetry. These images show a density on two mammographic views, but your doctor can't fully tell if it's a true mass. They'll request further imaging and evaluation to rule out cancerous or abnormal masses. Developing asymmetry. This asymmetry type indicates a significant change between past and current exams. The density may be new, or could have increased. These findings are enough to raise suspicion of potentially malignant cells. Additional testing. If your mammogram indicates asymmetry, your doctor will need additional images to determine if the change in shape or density is normal. The first step is to compare past mammogram images for changes in shape or density. If you've never had asymmetric breasts or if your asymmetry has increased over time, your doctor will request extra tests. Breast ultrasound. Your doctor may request a breast ultrasound. This method helps to diagnose abnormal findings from obscure mammogram images. A breast ultrasound uses sound waves that produce pictures of your breast's internal structure. The breast ultrasound images can help determine if the mass is benign, a fluid-filled cyst, or if it's potentially a cancerous tumor. In some cases, a mass can be both solid and fluid-filled. Breast MRI, magnetic resonance imaging, MRI, of the breast is a test used to help detect breast cancer or other abnormalities. While in some cases this test is used after a biopsy has confirmed cancer, breast MRIs can be used alongside mammograms to screen for breast cancer. This is specifically helpful for women with a high risk of breast cancer from family history or heredity. Biopsy. If your imaging test results come back abnormal, or if your doctor suspects the abnormality is cancerous, the next step is to have a biopsy. During this procedure, a portion of your affected breast tissue is removed for further testing and to check for cancer. If the biopsy comes back negative, doctors recommend regular breast exams to monitor any change. If the biopsy comes back positive, your doctor will talk with you about treatment options. Outlook. Breast asymmetry is a common characteristic for women and is often no cause for concern. However, if the size of your breasts change or the density variation becomes larger over time, these changes could indicate something is wrong. Research is still being conducted on the relationship between asymmetric breasts and cancer risk. Some studies' trusted source have shown women with breast cancer had a greater breast asymmetry, combined with other risk factors such as heredity and age, than women who were healthy. Further research is still needed. If you have a predisposition to cancer from family history or if you notice irregular changes in your breasts, you should discuss your concerns and options with your doctor. When should I worry about uneven breasts? Uneven breasts aren't usually something you need to worry over. That said, researchers are finding that uneven breasts may be a risk factor for breast cancer. A 2015 study in breast cancer examined the effects of uneven breasts on breast cancer risk. The study found women whose breasts were 20% different in size had a higher chance of breast cancer. The role between breast asymmetry and breast cancer risk is still largely misunderstood. We need more research to examine the relationship. For now, let your doctor know if you see any change in either breast size, shape, or appearance. They might recommend certain exams, like a mammogram, breast ultrasound, or breast biopsy. Daily life and coping. Uneven breasts are very common and usually nothing to worry over. Still, at a certain point, it might be hard to hide the difference in breast size. Women have reported a size difference of 30% or more is hard to hide in regular clothes. If you're concerned or self-conscious about your breasts, you have options. Try seeing a professional bra fitter. They can help you find a bra that fits both sides of your chest and hides any difference. Consider meeting with a counselor or mental health professional. They can give you support and guide you toward learning to accept your body. Join an online support group on body image or breast size to connect with women who deal with the same issues. Talk to your doctor about surgical procedures if your breasts are causing health problems or you can't accept them. Some surgeries can help improve the symmetry of your breasts. Summary: breast asymmetry, or uneven breasts, can be very common. Breasts can vary in size or shape for several reasons: genetics, pregnancy, breastfeeding, and certain medical conditions. You may not mind having uneven breasts, or you might feel uncomfortable. If you're embarrassed or self-conscious about your breasts, there are options for you depending on what you prefer.